Respiratory illnesses typically spike during the winter, especially with holiday travel and gatherings this time of year. But have we hit our peak yet? CBS 8's Brian White is working for you to break down the very latest numbers here in San Diego County.
Seeing a little bit of an uptick, but right now, over the last week, even seeing that level off and maybe decline a bit.
Anil Kaswani is Chief Medical and Operations Officer for Ambulatory Care at Scripps Health. He's been tracking 3 viruses, COVID-19, influenza, and RSV.
Looks like our most recent data point shows that we would have plateaued. And again, that's really encouraging news and makes a lot of sense given the holiday gatherings and travel that happened over the holidays.
I looked at the county's COVID cases. The daily hospitalizations peaked the day after Christmas at 198 and steadily dropped the next few days to 174 on December 30th. At Scripps Health, they've seen a bit of an uptick in COVID cases.
We have 80 patients in-house that have COVID, and that's compared to about 60 a week ago. To give you a context, our maximum COVID numbers were about 500 back almost 3 years ago at this point.
Over the past 6 months, we've seen more than 31,000 COVID cases and more than 9,000 cases of the flu and more than 3,600 RSV cases. But according to the county's numbers, weekly case totals for all 3 of these viruses started coming down the last week of the year.
It looks like for RSV that we may be past the worst of it, that we've hit our peak and coming down.
Edmund Milder is a pediatric infectious disease specialist at Rady Children's. He says these respiratory viruses have a lot of overlap when it comes to the symptoms they present.
People are going to have a runny nose, a cough, sometimes a fever, maybe some achy muscles, and it's hard to know exactly what you have. For most people, if you're healthy otherwise and able to stay hydrated and have a good amount of energy, these are things you can handle at home, no matter what the virus is.
While we may be seeing cold and flu numbers starting to decrease, as we typically do in January and February, both doctors tell me the flu shot is still useful.
Make sure that you're avoiding social contact, that we're not spreading these viruses. If you're not feeling well, stay at home as opposed to come into the office.
Working for you, Brian White, CBS 8.